Looking directly at COVID, this is a look at the 7-day test positivity rate over the past 2 months. So remember, this is the percent of tests coming back positive out of the total number of test results that were sent to the state. It remained pretty low until about mid-December. Now more than 1 in 5 tests are coming back positive.
Confirmed cases is a similar graph. This is the case rate per 100,000. You can see the number of cases started to rise by early December. What
we typically see is a lag between the positive tests going up and people developing cases serious enough to go to the hospital. So as expected, we are now starting to see a rise in the number of people hospitalized with COVID. As you just heard from Dr. Galley, more than 8,000 COVID patients are in hospitals across the state right now. That is an 8.5% increase over yesterday's numbers.
It is important to remember hospitals aren't just taking care of people with COVID. Patients who need a hospital bed for other health conditions, they still need care as well, which is one of the reasons why health leaders, as you heard, are so worried.
KCRA3's Stephanie Lynn joins us live now from our newsroom. She's been looking into the strain on hospitals in our area.
The demand for COVID testing continuing to soar as Omicron cases surge after a busy holiday season.
We are essentially overwhelmed. I think if you're going to summarize it quickly, we are seeing a tremendous increase in patients, not only in the emergency department, but also in hospitalizations.
Sacramento staff at Dignity Health sharing the stress of treating the nationwide uptick in sick patients.
Wearing a mask and protecting yourself protects your neighbors. It protects your kids at school. Sorry. I get emotional because I just think that we could probably do a little bit better as a community to prevent the spread, just a little bit. You know, it's not going to be perfect.
Telling us the number of COVID positive admissions at this facility alone tripled in a week. Most patients were not vaccinated.
So we have definitely seen an increase in patient volume and sick patients.
Marshall Medical Center in Placerville now in talks to become a state surge hospital as case counts continue to climb. The center's emergency room already impacted.
In a normal year, we would be seeing 80 to 85 patients a day. Over the last week, we've been seeing over 100 patients a day.
75 to 80% of the people that we're seeing are unvaccinated.
Early studies suggesting those infected with Omicron are less likely to end up in the ICU.
And what is your response to somebody who says, well, if I'm less likely to end up in the hospital anyway, why should I be concerned at all about Omicron?
We do have people that are hospitalized who are quite ill, and people are dying still from Omicron.
The uptick in those checking in with COVID creating competition for hospital beds.
It's a heart attack or the strokes or the traumas that are now fighting for space. I think if we all did our part, we wouldn't see as much of a burden both on the healthcare system, on the healthcare workers, on the schools, and everyone in between. Prevention remains the key. It's what we've always talked about. We're 2 years in, and everyone is tired. We are too.
We also connected with UC Davis health reps for this story. Reps telling me that their ER over the holiday break treated a record-breaking 300 patients in a single day. That's the highest it's ever been. Reporting in Sacramento, Stephanie Lynn, KCRA 3 News.